I want to go straight back to Scott Atlas, Hoover Institution. The president says Americans will have low-priced options, lots of low-priced options where premiums will go down from where they are now. You know this from the inside. Is that going to happen?
I think absolutely will. But you have to realize that the two components that determine insurance premiums are the regulatory environment, but the bigger component is the cost of medical care. And what this does, and I can't emphasize that enough, is it allows people to buy insurance where they have to consider the price of the care because it may not be covered. That's a very good thing. The way to get people to have cheaper insurance is secondary to reducing the price of medical care itself by empowering people and increasing the supply and other deregulatory mechanisms so that they actually care what the price of the medical care is.
Senator Rand Paul spoke right before the president. He said that this was a market idea, returning to free markets. Do you agree with that? Is the market back in the healthcare system?
Well, I think the insurance market certainly will be deregulated and there will be choices, and this is very important. But I think we need to do way more. And this is where the Republicans have really failed, not just to do more, but to articulate the reasons why these changes are important. They really have failed in educating the public.
Okay, the president promises such low prices for such great care that everybody's going to love it. Low prices for great care, even though what's covered will be reduced. Is that a legitimate claim for the president to make?
Absolutely, because most people don't need what was covered under Obamacare. They would rather buy a health plan that suits their family's needs and then be able to pay a mortgage or buy a car.
Right. Okay. Herb London is with us. Herb, I know you've been watching the proceedings here.
Yes, sir.
What do you make of them? Progress in the right direction?
I think it's progress in the right direction. I think anytime you engage in deregulation and create an environment for choice and for pricing and for an environment where people can make decisions on their own is desirable. And I think the president understands that. There's a lot more that has to be done. And I very much agree with the fellow from Heritage who made the point we've got to articulate the arguments more effectively. One of the reasons why Betsy does such an extraordinary job in writing about this business of Obamacare is because she is one of the few who knows how to articulate the issue.
I think it's the Hoover Institution rather than Heritage.
Excuse me. I'm sorry.
But I'm sure Scott Atlas won't mind on the grounds that the two are somewhat similar, I think. But one's in California, one's not.
It's the ideas that count.
Right,
yes,
exactly.
sir. Yes, sir. Yes.
Sorry about the labeling.
I want to point something out here. The moment that the president took the microphone, went to the podium, at that precise moment, the Dow Jones average hit another all-time high.
Yep.
And it has turned around from a minus 37. Now we're up 8-9 points. Is there any relationship between what the president said on Obamacare and the stock market? I don't think so, but
I don't think so. And again, it would be a stretch. One of the things that happens is, look, the market is very sensitive to a variety of conditions. But if you tell me that corporate profits have gone up very significantly, that's a factor. This very 5-minute speech by the president, a very limited speech, I don't think has enough of an effect.
We've got five Dow stocks at all-time highs. So
yes,
right.
We have. Okay. Scott Atlas, last one, back to you for a second. What do you want to see next within the realms of possibility? Because we're not going to get legislation out of Congress, but what can the president do with an executive order next to enhance what he's already started?
I think he can do more with deregulation, getting rid of some of the regulations on health savings accounts. He alluded to this with his health reimbursement accounts. Larger and less regulated health savings accounts are something that really are critical to people caring about the price of care and being able to make value-based decisions.